But an easier way to look at this, and a more useful way to look at this, is what we call cluster analysis. So I literally would recommend that you take these clusters of symptoms and make up a handout for yourself, for the patients. I have the patients go through and circle every symptom that they have and then add up the number of clusters that they have. For adults, if they have 8 or more, you can be almost guaranteed that they have chronic inflammatory response syndrome. One of my colleagues did a literature review of his records and found that this was one of the most effective ways to screen for mold exposure and CIRS. Along with 2 other things, the visual contrast test, which I said I'll go over, and then the biotoxin markers. So when I'm talking about the mold susceptibility, approximately 24% of the population has these HLA haplotypes. And then Lyme susceptible is about 21%. Dr. Shoemaker talks about a priming event where people have to have had some sort of inflammatory event, such as the flu or Lyme disease, a pneumonia, different kind of virus, surgery, trauma, etc. And then their genes will manifest a problem. So, for example, a patient could be living in a moldy building and doing just fine with their HLA susceptible haplotypes. However, when they get bit by a tick, have a surgery, get in a car accident, all of a sudden they can no longer handle the mold in their house, and they will become very sick with chronic inflammatory response syndrome. The other way that I think about it is somebody could be living very happily with Lyme disease, whether they know it or not, or doing very well, and then they move into a moldy building or their office becomes moldy. They will become very sick. And you need to be able to treat those things simultaneously, or at least treat the mold in order to get them better. It is possible that 5% of the CIRS patients are not genetically susceptible. They still need that priming event.